Okay, guys, I have gist for you.
What gist?
Let me break it down.
Hey guys.
We are back.
Back again.
Another episode of I Have
Just for you. This is episode 3.
Look at us
So,
go.
and we have, guess what, guys?
We got another guest. Who are you
We're
gonna
very
argue
excited.
with? Who are
No,
we?
honestly, you guys, we're actually, anyway, we'll talk. But we'll let the guest introduce herself.
Okay, guest, who are you?
So I'm Adanna. I
Yes.
am an obstetrics and gynecology doctor.
Yeah.
Ooh.
So just to break that down, obstetrics basically is care of women through childbirth, so the antenatal, intrapartum, so in labour and postnatal period. And then gynecology is basically just women's health. So women with heavy periods, early pregnancies.
She does it all, y'all. And
Mix
she's
and match.
also my bestest friend in this entire world. That's the most
The
important part
person, you've
of
heard
this
her
podcast.
reference maybe 10, 15
Probably 15 times.
I love my
since
messages.
she started, so
That's her, y'all. So, yeah, okay.
brought her in real life for you guys.
Right? We're going to get into it.
Exciting.
it.
Okay, so I'm going to start today.
Yes.
So what made you want to be a doctor, first of all,
Oh, a
let alone
doctor.
Yeah, a
specialise?
doctor, right?
Yeah, in this.
I'm one of those, some may say losers, but
Definitely not a loser.
wanted to do medicine since I was 14.
Okay.
I always just wanted to help people, better society. I do believe that I've been put on this earth to better society. So
She has,
that's
yeah.
really what I wanted to do.
So cute.
It also helps I've got lots of family members who are also
Oh, yes.
medics. So, I mean, a lot of them told me not to do medicine, but I was like, no,
I'm doing it.
I'm going to do it.
Mhm.
And here we are today.
Okay, so why did you specialise? Why obs and gynae?
Why obs and
Why aren't you a
gynae?
dermatologist or a something-sologist?
Yeah,
So I
one.
knew you were something. Oh my God.
that one. Yeah.
You're just making it worse
Yeah.
now. So I knew that I wanted to be a surgeon. I'm very practical. I love the way I think. I like to do something and see the outcome. Sort of wishy-washy things in between. My brain just doesn't really compute those things.
Okay.
But then I think what helped was going to an all-girls school, being an eldest sister, having a younger sister, having lots of cousins who are women. I always wanted to do things to better women's health. And I just thought, what a perfect specialty that I can have a mix of medicine and surgery. And my main focus is to look after women and better
She said
better
forget the
them.
men. Throw the men in the bin.
Oh my God. They need help too, but not my help.
Yeah, no, that's
Get out
amazing.
somewhere
That's so
else.
beautiful.
Yeah.
Okay, no, we love that. Okay, so how long have you been in the field, and how did you get into it? Like, what's the
God,
process?
this is going to make me sound really old.
Ooh.
No, it's not.
Don't worry.
So I've been a doctor now for 8 years,
Okay.
but I've been in the specialty technically for 7 years, but I took 3 years out to do my doctorate. So I'm now in my 4th year of training. It's clear to say what training means. It's not that I'm not a doctor. You're just training to become a consultant and finish the training of the specialty, basically.
Okay.
So,
That's
yeah, but it's,
amazing.
you're always learning even when you're a
But
consultant.
uni
The learning never ends.
How did you get into that? Uni? 5
Uni,
years, 10 years,
5
16
years, 5 years.
No, wow.
5
Listeners,
years.
if you
So when
wanna
all
get
my
into it,
friends, because I did a lot of sport, most of my friends are non-medics, so they all left me after 3 years. And I was like, oh God.
You were on your own.
I was on my own. No, I had my medic friends, but my core sporting friends all
all
left
left.
me and all moved to London, so I followed them
Yes, and here she is.
from up north.
And what a time we've had.
We are-
What a time. We had a time.
Are you guys going to be discussing that today? Or are we saving
Absolutely
that for-
not.
Oh, okay.
Listen, you
That
have
was
to
a
watch the
different
stories for that one.
Okay,
because-
that's fine.
So, Dr.
Yes.
Adanna, yeah? Our question, what is your opinion on, let's start with the yoni stuff. I've heard a lot about yoni steaming. You season water with rosemary, paprika, pepper. I'm joking. All these herbs, and people like steam their hoo-ha with stuff, their vagina with stuff. What is your opinion on that? And also, I don't know, is it yoni pearls or like the little pebbles you stick up in your vagina? What is your opinion of those things?
For starters, I just want to say that with regards to holistic care,
Yeah.
I'm happy for everyone to do whatever makes them feel better.
Okay.
But as long as you're completely aware of the potential risks
Okay.
and the evidence base for the benefits you think you may be getting from them.
Yes.
Because I'm very into research. I'm very into something needs to have evidence for me to even suggest something. For starters, the vagina is such an intelligent organ. We are all so lucky to have a vagina. It is self-cleaning. Like it's it's self-cleaning. So
Stop buying the weird stuff.
So because it's so intelligent and so important and just functions so well, I think it's really important not to mess up its ecosystem. So it has an ecosystem called the microbiome, which is bacteria which don't cause infection but are there to protect you from certain infections, to keep the vagina well lubricated. So when you steam and insert things into your vagina that shouldn't particularly be there, you can mess up with that ecosystem, and that can cause you to have more thrush, more bacterial vaginosis, just generally more discomfort. So I generally don't advise women to use steams or insert yoni pearls, particularly with steams as well, is that you're putting very hot water above your perineum, and I've seen women come in with significant burns to their perineum because they've been steaming. So I think, yes, I'm all here for holistic care and whatever you want to do to make yourself feel better, but there needs to be an evidence base. And don't forget, all these things all stem from the patriarchy. It all stems from the patriarchy, because it is the patriarchy that has told us that our vaginas and vulvas are dirty and we need to do these things to make it clean. And it's completely wrong. So I think if you take a step back and think, actually, why am I doing all these things? I just think if you wouldn't be doing all these things if you didn't actually love yourself as a whole person. You don't need to do these things. Your vagina is very intelligent and you're very lucky to have one.
We like that.
What females be doing stuff? Every day smells.
I be following Adanna on Instagram, and I see that you've written some papers. Would you like to talk us through some of your favourite?
You've written. She's written a lot of peer-reviewed papers, guys. Big ups to her. What are your favourite papers? That is a good.
So my doctorate was basically on evidence-based and novel strategies in managing perineal wound infection. So perineal wound infection meaning perineal wounds after childbirth. So you can have a load of grades of tears that women can have after childbirth, going from a first degree tear that's just the skin, all the way to a fourth degree tear that's a tear that's involving the rectum and the anus. Okay, right. Don't be nervous, it's okay. Unfortunately, these things happen in a small percentage of women, about 3%, but it does happen. And the difficulty, there wasn't any evidence showing how we look after these women who have complications. And the difficulty is, the thing I found really strange, that 90% of women will have a tear after having a baby. But there was no evidence out there how do you best manage these women who have complications? How do you best support them transitioning in their postnatal period? Because women will go home and be really, really nervous and scared about how their wound is going to heal. And if I get an infection, am I going to be scarred for life? And, the doctor's just given me antibiotics and sent me home, but how long will it take to heal? So basically, I created prediction models to show how long perineal wounds would take to heal. And thanks. And different risk factors, so women who've had third-degree tears or women who've got significant amounts of bacteria in their wound, women with those risk factors, how long will it take their wounds to heal, as a way for clinicians to basically pick up different factors for women they see in a clinic, for example, or in A&E, and be able to tell women, actually, you've got all these factors, your wound is this size and this depth, meaning your wound will actually probably take 4 weeks to heal. Or actually, it's probably going to take 8 weeks to heal. And let's try and see you a little bit more regularly in the clinic and follow you up more regularly. Not that you need more antibiotics, but we can see you a little bit more regularly. So that was probably my favourite paper from.
You can see the nerd coming out of her.
I'm such a nerd.
It's always nice to see people talk about things they love. Like
She said I'm deep. Perineal one.
Okay, I say something bad. So the reason we really wanted to bring her down here is because we were talking and we find that the topic of contraception is not spoken about enough, guys. And I feel like sex isn't taboo.
I mean, people are having sex.
A lot of people having sex. Some people talking about having sex. So we really wanted to get an understanding how all of you aren't pregnant. So what they could possibly doing to be preventing that. So yeah, we'd love for you to talk us through some contraception. I just think
Do you know what? One contraception that I want you to start with. You know this whole measuring of temperature. I don't know what it's called.
Natural cycles method.
Natural cycles, yeah. So what do you think of that as a form of contraception?
It's on the list on the NHS website.
No, it is a proven thing. But you know.
But then it also gives its failure rate. So if I saw the failure rate, I probably wouldn't choose it myself. Yeah. But everybody, each to their own.
Not everyone wants to put stuff in their body. I get that.
I think it's a good way of fertility awareness, but it does have a very high failure rate. So, guys, I shouldn't be laughing about this thing. Stop. It isn't something that I would recommend, but I do understand some people are very, very sensitive to hormones. Okay. So actually, if it's a method that has been tried and tested and works for you, then absolutely fine. But again, you understand the potential risk of pregnancy. Okay. And there you go.
Okay, so what's some other contraceptions? Give us.
Would that have a lower risk of pregnancy?
So I'm going to break it down into how contraception works, and then that will sort of tell you how different methods will work. Okay. So basically, when you're thinking about pregnancy, what you either want to do is stop you ovulating, so no egg, or you want to stop fertilization, so you don't want the sperm reaching the egg, or you don't want anything implanting. You don't want the egg implanting, basically, okay? So the ones that everyone, when they first go to their GP and the GP talks about contraception, the first one the GP may offer to you would be a pill. Yeah. So that can either be combined hormones, so estrogen and progesterone, or can be progesterone on its own. Yeah. Okay. So the estrogen and progesterone, they work by the combined pills. So that could be your microgynon, for example, people may commonly know it as, or your Celeste. Those are your common ones you might be given. They stop ovulation. Right. And they have a failure rate of around 9%. And the reason why I use the 9% one is because they base it on typical use. So, I've been out today and I forgot to take my pill, or I've taken it a little bit late, or but please don't miss your pills because you'll fall pregnant. So don't do that, okay?
And the end.
So that is your combined contraceptive pill. Then you've got your mini pill. So that's your progesterone only.
I've been on the mini pill.
Oh, cool.
Yeah. So what that does is basically it thickens the mucus of the cervix, so stops sperm traveling through and fertilizing anything.
So it really says you're not coming.
Exactly. But that pill is one that you don't have a break with, like
take
the combined
every single day.
So you take it every single day. Exactly. That again has a failure rate about 9% as well. And the thing with the mini pill is that the timings are quite different to the combined pills. The combined pill, you just take it the same time every day, while with the mini pill, you either have traditional ones where you only have a 3-hour window period, so you need to take it within 3 hours of the time you take it. Yeah.
The midwife is shamed us slightly.
You need to be reading the instructions they give you.
I will say though, you do have to read the instructions, because I think it was like I'd been on it for about a year before someone told me that. Like
really?
Someone
but I mean, the pill, but the one you may have been given may have been called desogestrel, and that's got a 12-hour window period.
Okay,
so it's a bit better than the 3 hours. Is really you must take it on time.
Wow.
Yeah.
You need to leave that one by your bed.
And wake up and take it.
Alarm. Literally.
Exactly.
Yeah. Okay.
And then we go on to your longer acting methods, which is one that I always really, really like to try and push for women, because I think taking a pill in itself, even reminding myself to take paracetamol 4 times a day. Do you know what I mean? And everyone knows what I'm like with multivitamins. I'm so bad. Like I
take it once a month.
Exactly.
I've done everything.
Am I better yet? I've taken 1 cod liver oil tablet in a year. Am I better yet? No, it's so bad. So your long acting methods. So you've got your injection. Which again is progesterone, and you can have that every 14 weeks or every 10 weeks, depending on which one they give you. Around 20% of women will not have a period with that. The thing you have to remember with the injections is that, particularly if you're quite young, so under the age of 18 or over the age of 45, it can affect your bone density. So it's important that your doctor will review you sort of every 2 years just to make sure your bone density is fine. Also, it can cause irregular bleeding when you first start. It's a lot of women, around 50%, will stop it and be like, no, this bleeding is
out of control.
It's out of control. I just can't do this anymore. Right. That has a failure rate of about 6%. So It's better
That's
than the
a
pills,
good-
which is
right?
good. I think
That's
always
good.
go
I
for a
love the
long-acting
world.
method.
Yeah.
And the next long-acting method is you've got the implant.
Oh, yes.
So I'm not going to show my swollen arm to everyone because I've got a bicep injury. But basically, they put a implant in your arm.
Right here, right?
Yeah, I'm sure everyone's
And it
felt at
stays
least
in,
one frame
yeah.
or implant in their life.
And it stays in for around
Seed.
3 years.
Mm-hmm.
And it's got the best failure rate of 0.05%.
Wow, I didn't know it
From
was.
9
It's
to
good.
0.05.
It's
Yeah,
good.
it's really good.
And again, you may still have some irregular bleeding, which usually may get better, but in a lot of cases it doesn't. Okay. And then my favourite ones.
Oh, yes.
My
Coils, right?
my favourite
The
ones,
coil.
the
Okay.
coils.
Yes.
So you've got your intrauterine device. Most people know it as the Mirena, but you've got lots of other intrauterine devices. So you've got the Levocet, Kylena, Jades. There's different ones with different levels of hormones in them that you can use, and they typically are licensed for around 5 years. Some of them are licensed for 3 years only.
Okay.
And they basically thin the lining of your womb to stop implantation. And often the lining of the womb is thin so much that most women, not most, a significant number of women will end up not having periods. Which I think is always, if you're somebody who suffers with heavy periods, it's a really good alternative to use as well. And its failure rate is about 0.2%.
Wow.
So
We love
it's good. And it's in for 5 years.
Yeah.
It's perfect.
Yeah.
You're sorted. And also because it's just in your uterus, the actual hormones don't enter your bloodstream. So you don't get the side effects you may notice that women get with the combined pill or the progesterone-only pill. So like nausea, bloating, breast tenderness, headaches. So you don't get that. 10% maybe of the progesterone sensitive, but because it's not going into your bloodstream, you don't have those symptoms, which I think is also really, really good one for women who find taking the pill really, really difficult because of their symptoms. And then your final one is your copper coil. That's licensed for 10 years. The thing about the copper coil is it can increase your bleeding. So it can make it significantly heavier than what you're used to. But then again, it's a very, very good form of contraception. Stays over 10 years. It's got a failure rate about 0.8%. So it's a good option as well. Also, it's used for emergency contraception too. So actually, if you have had unprotected sexual intercourse or unmissed your pills, if you are taking pills, then that is an option that can be given to you as well. So yeah,
So many types, y'all.
so many.
There are so many. It's really just to pick which one's best for you, right?
Exactly, and I think that's why your peers are so important. Like talking to your friends. I mean, in our group chat, how often do we talk about what contraceptions should people be using? I'm like, Mirena coil.
SA's like,
Yes, baby.
SA's my advocate for that coil.
Because that Mirena coil,
You guys are.
It's changed my life.
changed my life too.
I have a disclaimer about that coil.
Oh no.
SA's
Oh
gonna
my
laugh.
gosh.
Did you have a really
Let
bad
me be quiet.
experience?
Yeah.
I had a bad medical experience earlier on in the year, so I'm not really enjoying visiting hospitals at the moment.
Yeah.
Because of that, when I got my gynae referral and she wants me to get the coil, she said it would be under general, like they put me under, I'd be in the theatre. When I got to the outpatients ward, the consultant basically laughed when I told her that. And I was like, oh, okay. I was literally just talking. I was like, I wish you were my consultant. I got so overwhelmed, I was crying in the office. Like, it was just a lot. Like, got there, and then she was like, okay, we're just going to try it. Okay. I do not have a coil, guys. So that's how the trial went. They're going to have to put me under. They're going to put me under. Because I feel like my pain threshold's low, and now I'm triggered by hospitals. So it's just,
A lot.
The message I sent Esther is, I've never been so proud of somebody in my life. I can't believe she did that. Oh my God. She's the strongest girl I know.
A lot of our friends have said that they found it quite uncomfortable, even just inserting the speculum in itself. I personally, maybe because I've done a few, I didn't find it that painful. And I'm onto my second one. now.
For me, personally, I too am on my second one. I found it so painful.
Oh, sorry.
I found the insertion is wild.
Like that.
But I feel like I have a decent pain threshold. So I would just grit my teeth, take the pain because I know that it's going to end soon. And then I'm on my merry way. But for me personally, the insertion was painful. But after that, I'm free. Like, I'm good.
Yeah. I think don't be afraid to. I think I'm sorry that they discussed Gem with you. That never happened. That's really annoying because in itself already, because like pain is such a cycle with your brain. So already you're anticipating a general. You've got there. It's not a general. So of course you're going to find it more painful because it's not what you're anticipating.
Literally.
So I just think if any listeners, like if you know you find examinations uncomfortable and you want to have it under general anaesthetic, just make it clear to your clinician. Even if you need to bring an advocate with you to be like, no, she really needs to have this under general anaesthetic.
That's the thought for me. It was going, no, honestly.
Good. It means that you probably might have to wait a little bit longer to be put on a waiting list.
Which is fine.
So just be on some contraception beforehand, please.
But
Just
fine.
But
yeah,
just make it clear.
No,
that's what you want.
Yeah, thank you.
No, it's
and
all
you know
right.
what? I realise it is sometimes just to have someone to advocate for you.
100%.
I feel like that as a midwife, I see a lot of the times women may not know all the information and they may be trying, and then you see people trying to steer them towards a certain decision. No. Let me advocate.
Exactly. And then when you're in the throes of labour,
right?
and you want to try and make a
quick
concise decision,
and it's hard
when you're in pain,
things
no.
are going on. No, yeah.
No.
Yeah.
No, love it. No, thank you. Please be advocating for people because
advocate for your
100%
for your patients.
Please.
Yes.
No, honestly, I am traumatized. One day I'll tell you guys how bad it's been. A year. Me and hospitals have had a year, but want a break.
Did your letter say you were going to outpatients?
Yeah, you know, and I was just thinking this is so odd, and I called them up because they were doing a different procedure.
Yeah.
And the forms they sent me for the procedure they were meant to do was a general procedure.
Fine.
Like they told me, they gave me the outcomes general, but I didn't have a pre-assessment. But in my head, I don't know that I need a pre-assessment.
Yeah.
So I'm just going. I was like, when we get to outpatient, they'll move me to where
Sure,
I need
instead of
to
you
go.
to message me.
No, honestly, I
would have been telling you like, sis, this is not making sense.
No, yeah. But they actually this week booked my pre-assessment. So.
Oh, perfect.
Yeah,
Good.
they're moving quickly.
Good. I mean, they have to now. Now they've already
messed it up.
made a big mess up.
Yeah, guys. Okay.
Good.
What do we want to ask you next? Contraception. You didn't talk about condoms.
Do you know? It's so funny.
It's interesting you say that.
About them.
Yeah.
Yeah, most people do. That's why I want to know how everyone's got pregnant.
It's bad because in my head I need to think: do I need to even explain condoms?
No, you don't.
But you do because actually there are even female condoms. Like there are lots of different condoms that you can use.
But I've never seen it, and I don't know how that would work. Is it like a you know people have period cups? That's how I kind of see it.
Yeah,
it's kind of similar, but not as thick as a period cup.
Right.
Just same material, but the aim is for it to sit inside.
I just
To be able to accommodate, be able to accommodate a penis, it needs to have some stretch to it.
Just some though.
Yeah.
Get it out.
You take it out.
No. Any type of investigation or anything.
No, but that's
like
so
that.
bad of me. I don't even know why they even talked about condoms.
No,
but I don't know, maybe the clinician in my head, I was thinking I want to have the most effective, safest option.
Exactly.
And actually with
You
a
have the
condom, there
failure
is still a
rate.
failure rate. It's still about 8 to 10%.
I feel like I did defo give you a trick question because I feel like nobody thinks about condoms.
No,
like,
it's
condoms
true.
aren't, that's why I really wanted us to talk about contraception because how are you people not pregnant? Just
Is there not this male pill?
They said it was
So
coming
I know they've had their phase 3 studies, so studies on humans basically, and then stage 4 is at their post-marketing research. They basically have a look at it in the actual outside of a research setting. So I think that's still being done, but I don't know. Like I don't know whether I'm in the echo chamber of my own social media. But everyone's like, I won't take this, I won't take that. And to be honest, I don't trust men.
I was about to ask, would you
so...
trust a man to have taken his pill every day?
No.
I don't know.
But there are some partners who are with women who really cannot take hormonal contraception.
Yeah.
And actually, if you're in such a loving relationship and your partner's like, right, there's no other option then, isn't it? Maybe they would do.
I find men forgetful.
I mean, if I can't take a vitamin,
no, literally,
how can I expect my partner to take one?
Extreme things I've done to try and remember to take my vitamins that I believe people can forget to take pills. Oh yeah, but I guess we'll see. Like I feel like in 10 years.
That's why I love research.
Normalised
In 10 years' time, men will be taking pills. And I'm
Yeah,
like,
yeah.
I remember the day where this was being researched.
Yeah.
So I love research. It's so interesting.
You love to see it. You love to see it.
Hey, we'd love for you to give our listeners, we have a very female fan base,
Yeah.
just some facts about like women's health. I think in America, or at least on TV, like people have a gynae doctor they see. The reason I get to see a gynae doctor is because I complained to my GP for months and then I got a referral. So I feel like women's health, unless you do your own research, isn't necessarily easily accessible, just the information. So is there any like things that people you think they should know that they might not?
First thing, knowing what is normal and abnormal for you.
Yes.
You could be doing cha-cha-cha-cha-cha with all your friends and saying, is this normal? This is not normal. But actually, for them, it may be normal, might not be normal for you. So you know what your periods are like normally. You know what your discharge is like normally. You know what everything looks like. Like I always say to people, like, go get a mirror, go and have a look. And another really good thing that I get people to look at is something called the Great Wall of Vaginas. It should be called the Great Wall of Vulva, but alas, the Great Wall of Vaginas. And basically shows lots of different vaginas, what they look like. So I think when you're younger, you'll be thinking like, oh, like, this is here, mine doesn't look like that, and all this. And obviously the porn industry has ruined everything. Yeah. So I think just knowing that actually you're okay and it's normal, and you can't let any good body chat to you about what it looks like, because actually this is normal. Yeah. So that's the one thing, is getting to know what's normal for you and just loving yourself, obviously. And then the second one is pelvic floor exercises.
Please tell the people, because I haven't been doing it myself.
I'm such an advocate for pelvic floor health.
I'm even doing it now as we sit.
Because the difficulty is, I think, as women, when you, not even when you have children, when your pelvic, basically, let me explain what your pelvic floor is. So your pelvic floor is a sling of muscle, which basically holds up your vagina, your bladder, and your rectum. So imagine if that sling of muscle gets weaker, things can drop down. Things can leak accidentally when they're not supposed to be leaking, because nothing is as strong as it should be at holding it up. So as women get older, like, because it's a muscle and collagen is very important to your muscle, hormones like estrogen are really important for good, strong collagen and the creation of collagen. So as you get older and your hormones level drop and you get into the menopause, women then may have pelvic floor problems. When you have children and you've had a big head stretching your pelvic floor, even just carrying the weight of a pregnancy is putting stretch on the pelvic floor. You see these women come in with symptoms, and they won't come in just straight at the beginning. They'll come in their 40s, their 50s, because their 60s, because they've been so embarrassed to come and talk to anybody about it. Like, oh, like, this is just after having a baby. Like, I'm just wetting myself, and I just thought it was to do with childbirth. Oh, I'm just leaking poo, and I just thought I don't really want to see a doctor. Oh, like, my uterus is prolapsing out my vagina. I just thought, oh, it's just, I'm a bit uncomfortable, but it's just to do with having a baby. And actually there are methods. Sorry.
No, I know what Sarah's thinking.
Do you know what I mean?
Put me off having a child.
No,
I'm not put off. Okay, I'm just scared.
Okay.
But I just think like it's important you even talk about these taboo subjects, because exactly, and I think pelvic floor health has got such a bigger voice now, with lots of people putting it at the forefront of people's minds. So women aren't embarrassed to come and talk about it, because millions of women in the UK are affected by it. And the one big prevention thing that you can do is your pelvic floor exercises. Okay. Well, should we all do one together now?
Can I tell us how to do it?
You don't know how to do it.
The Kegels.
The Kegels.
Oh yeah,
if you want to call them that, but the pelvic. So basically, you're going to pretend like you're holding in a wee and a fart. Okay. And it's like a zip and a fart at the same time. And you don't want to do it all the time. And you don't want to use your abdominal muscles. Okay. And it's like a zip from the front all the way to the back. And we're going to hold it.
Doing it properly.
We're going to hold it for, ideally, maximum is around 10 seconds. So let's hold it for 10 seconds.
I don't know.
Okay. Okay. Right, you ready? Yeah, okay. 3, 2, 1, go.
It's a lot.
Yeah.
I'm not even timing, but...
Wow. Somebody
That's
should
about
be...
10. That's about 10.
Yeah,
okay.
I got that.
And then you make sure you relax for 10, because the relaxation is so important. It's like a zip.
Okay. I've been doing it wrong. Okay.
So sometimes when people are starting, I get them to do it when they're lying down in bed, or if they're sat down, and then as you progress, you do it as you're standing up. You're doing your washing, you're doing your cooking, you do it as you're standing up.
How often are we meant to be doing all these when I go to the gym?
So 3 times a day.
And I was thinking
3 times a day.
I was thinking 3 times a week.
Guys. So I always say the most important, what 3 things do you do in a day? You have your breakfast, your lunch, and your dinner.
Oh my gosh, as you can do it then.
So you do it then. Breakfast, lunch, and dinner. So 8 squeezes. 8 squeezes. 8 squeezes.
That's 80 seconds of my life.
Oh, no, but I don't want you to do 10 seconds when you're starting. Start with a short squeeze and a relax. Short squeeze and relax. And then as you progress, you're trying to hold as longer and longer for a maximum of 10 seconds. No longer than 10 seconds.
You can do that.
But the relaxation is just as important. So the relaxation needs to be as long as your squeeze. Because you imagine if everything is too strong and too tight, then you can have things like pelvic pain, you can have painful sexual intercourse. So the relaxation is really, really, really important.
Okay, we learned something today. Listeners, I hope y'all learned something today, because I did.
You said painful sex, and I feel like I have a question around that, but I don't.
Okay.
We're gonna ask someone off camera.
Yeah.
Not
my personal question. No, we want to help you
You
guys.
can ask me
I'm actually fine.
anything.
Thanks, guys.
And my last thing is,
yes.
and I hate using the word hygiene because it's not dirty, but vulval hygiene, like you've already talked about yoni steams and pearls, generally would advocate for them. Things like Femfresh, don't use them. Don't douche inside the vagina. Don't do that.
Okay.
You're just going to ruin the ecosystem. But like I
microbiome.
said, it's a very, very intelligent muscle organ. So you got to take care.
Take care of yourself.
Yeah.
Love that. Thank you.
Fine, top 3 tips.
No, honestly, it's been
Snaps.
amazing getting to interview, I guess.
I know, thank you so much.
And we've learned a lot. Well, I've learned a lot today.
Hope
Maybe
so.
I already knew the stuff.
If any of your listeners want to ask me anything, that's also
we'll put
fine.
her details.
I
We'll
don't
put her details
mind.
so you can contact
Don't
the
mind.
doctor, the good doctor.
With any of your
I won't give you
questions.
medical advice, but I'll refer you
to
where to find your
Yeah.
information.
Okay.
Love that.
Alright.
Appreciate that.
That's
Thank you
all right.
so much.
Should we try get a dilemma
Let's
in
get a
before
dilemma
we
in.
slip away?
Yeah.
Do you want to do one?
Okay. All right,
Sweet.
now. we're gonna
I'm
do a
excited about
dilemma.
this.
Yeah, it's
I
fine.
don't even think I've read this dilemma, so we'll all be shook together. Okay. And the thing is called I'm snitching. Okay.
Okay.
Well, I'm scared already. My mouth is open. Okay, so I'm a groomsman, one of 8 others, and I want to flag from now, I'm not the best man.
Sorry.
Okay. I've been hearing on the streets that weddings aren't the best coordinated events, and Lord no, this one is following that trend. The wedding isn't till next month, but stag do hasn't even happened yet. Don't call me Raven, but this stag do is giving me notes of another podcast. We know.
Oh,
Yeah.
I know.
Be concerned,
No,
boy.
yeah. The best man isn't active enough. The group who's the groom's brother, and he's in the group for vibes, and it seems, and I feel like I'm the only one pushing things along. To get an apartment booked for the stag even seems to be an issue, let alone the activities, dinner, etc. My dilemma is it time to tap the groom in or just start putting everyone on blast? Oh yeah, put everyone on blast.
No,
Put
yeah.
everyone on blast. Because I just feel like on that day, the groom is meant to be relaxed.
I mean, we've talked about this today. You know my feeling on stag and hens.
I know.
Abolish the stag and the hen.
I don't know what to say.
Abolish
Cancel
it.
everything.
Cancel everything. Abolish it because it's useless. We don't need to
I
do
love
it.
the party, so I
No,
can't take
no.
it to
I'll see you all
apologize.
at the I'll see you all at the wedding.
No,
I
but
think you put everyone on blast first.
No, me
before,
too.
like, I think
I'm with
you
you.
go mad with everyone before you go to the groom. I think the
No,
groom is the
actually,
last.
I
effect.
think you need to press the best man.
But that's his
first.
role.
Press the best man.
I hate people.
The
asking
wedding
people
is
to do
next
their
month.
jobs.
Stag do you haven't organised. What's the meaning?
Do you hate your brother? And if so, how did you get best man? Like, honestly, though, that will be my question.
And if
Yeah,
it's
you
a
know what's
last minute
bad
thing,
though?
you
I
wanna
bet
do
it's a
that.
sibling.
It is. He said this is his
It's his
brother.
brother. It's his
Ah.
brother. It's brother.
Yeah.
You know, the way, you
assume
know,
that?
you,
Yeah.
I even assume
Yeah.
because
No.
that's how siblings move.
No,
What are you
yeah,
doing?
just being useless. Because why are you being useless? Press the breast man. Corner him. Call him something. Yo, we're gonna organise this, and we're gonna organise it today. Why hasn't it been done already?
You know what's so
Before you
bad
put
though?
everyone
I'm
on
so
blast.
type A though. Like I can't even be bothered with all of this.
Yeah.
All of this wahala. I would just be like, here are the details
Well,
for the stag.
Pay the money in here.
Everyone pay the money in here.
But that's
and it's
that's
done.
some sort of organisation. The brother is relaxing like
No,
that.
but
I
this,
think-
but this one is saying he wants to put people on blast. What's the point? Just organise it.
No,
Because it's not
yeah.
happening.
Okay, you know what? That's the point.
Just organise it.
No, yeah. I hate doing things like. that
But
other
that's
people
what the
should
best
be
man
doing.
Because you'll then be upset when you
Yeah,
arrive
exactly.
at the
That's
event
the-
and
that's
it's
the
not
thing.
what you
I
wanted.
will weigh it up. I feel like you need to weigh it up because if you're similar to me, you don't like doing things you don't want to do, which is
Yeah.
fine. It was someone else's job. But I get very annoyed when things are done poorly.
Okay.
So it's for me, it's value add to just do it myself.
Mm.
But if you're not an organizer yourself,
Me? I don't be organising nothing.
It's
I
that one away.
organise everything for
yeah.
them.
Oh no, she's told us. No way. I'll get
I
our listeners know.
can't do it. It gives me anxiety. I hate it. Mhm.
She's running.
I love it.
away.
I'm so
Yeah.
type A.
Same,
It's just for me.
fun.
Also, I just nobody will do it as well as I do it.
She's doing it well. Both of you be doing it well.
Like, yeah, I like my way.
So boy, yeah. I mean, that's all about different opinions, I guess.
Oh yeah.
Yeah.
Abolish the
What did we
stag and the
say to
hen.
do?
Good, it's very good. That's our opinion. I say corner the best man
And
really go at him, because what are you doing? Do you love your brother? Do you hate him?
they hate themselves
Okay.
sometimes, you know.
Corner.
Like some siblings don't like each other. I was seeing
Yeah.
that someone talk about that on TikTok today, and I think that's so interesting.
Maybe your brother doesn't like him. Maybe.
I
And
say-
if he doesn't, then he
Why
should just
was he
move with
best
whatever
man?
that he should do. Maybe he
didn't.
should organise it himself then after that.
Also,
What
the
do
groom
you-
should know.
Like-
And in that case,
No,
sorry,
no,
in that
no,
case,
no,
sorry for
No,
yourself.
No, I don't think the groom should be involved, because this is a
No, I mean the
standard
groom should know that his sibling
Is
will
useless.
behave like this. No, and I'd actually say sorry for yourself, because you're the one who chose him as best man.
No,
So I don't understand.
Genuinely, like, why did you not pick an
No.
organised friend to be your best
Exactly.
man if you know who your mother
Oh, it's
is?
true. Do you know what it is though? Some people's like best friends may not be your best man at your wedding, and maybe they
but you-
start
But
differentiating.
you pick your maid of honour, you pick your best man. And obviously, they're going to be one of your closest friends, but the one who can get stuff done.
No, yeah, I was gonna say I think the closest friend thing is nice. I
But
think it's a
it's
cool
nice.
You need to
concept.
choose someone that
People,
makes sense.
some organised people who at
Yeah.
least some people who can follow instructions if
Yeah.
someone else is organised,
Yeah.
or people who are organised themselves.
Yeah.
Because that vibesy group.
At least I know when the pressure comes, Ezra will follow suit.
Yeah, I will.
No,
follow-
Slash, she
I will
knows
fall
that
in
I'll
line.
cry.
I will fall in line.
My sister's militant, so I'm not worried about that. Like, if you can follow Shah's instructions,
Yeah.
they were
Fine.
fine.
Yeah.
If you can't, then don't worry about it. Because it's not me that. Why are people calling me with stress? No,
Yeah.
never. So, are we gonna do one more dilemma?
Yeah.
Yeah?
Yeah. Okay.
Okay. Hey guys, wanted to grab your opinion on something. There's this guy I've been dating for about 10 months now. I love spending time with him. When we're together, I feel on top of the world to born out. Oh, people are really loving. People are loving outside. Okay, fine. He makes me feel like I'm invincible.
Oh, that's
wow.
so nice.
No, honestly, I'm actually did. Oh, wow, okay. It started as a situationship.
Okay.
I was not planning to catch feelers at all, but now we're 10 months in and I'm falling hard. Spoken to him about it, and he feels the same about me.
Oh no, there's a butt coming, and now I'm scared.
But typical man, he's not in the right place for a relationship.
Oh,
right
here we go. That
don't-
old chestnut.
now. I don't want to pressure him, but as my 31st birthday approaches, I feel like I'm wasting my own time. We've had a few conversations about it, but he's quite avoidant, and it seems any kind of pressure and he backs off from the relationship altogether.
Okay.
I really like him. What do you think I should do?
Sounds like a dilemma. I could have written it about 6 times about myself.
No.
What's going on here? This
As
is too much.
somebody who
Did
has-
somebody write about my life? That's actually weird. That's actually private. But okay.
who has been through that.
Oh, you've been through it.
Okay.
God.
Doctor.
Not you, been doing.
But as somebody that's gone through it, my solid advice is run.
Run
Run,
Run
yeah.
for the hills. Don't look back. Because there's going to be somebody that's for you that you're going to fall in head over heels. Who's going to love you,
Exactly.
do right by you. And he's going to be like, yeah, you see you, I want you. Bam. There's going to be no distractions. No, I'm not ready, nothing. It's going to be all guns
Loving
blazing.
you is so important to him that will be his thing.
And that'll be enough. But this is like, it seems like it's 85% it, and there's 100% it.
But
out there,
what I'm
trust me.
missing though is that they're in a situationship.
No,
Yeah.
but like it's
But
10 months
but
situation.
they're
It's
10
not a
months in,
relationship.
so she's still in the situation.
Yeah.
So
Like, that's
this is what I'm
just
sorry.
like,
This is
yeah.
what's confusing me because
She's
you've
about-
not
now she's
moved on
feeling on top
then.
of the world.
He has
Yeah.
not said, "Do you want to be my girlfriend?" You're right.
He's whispering sweet
But
nothings in
that,
her ear.
for me, also, yeah, run.
No,
It's
yeah.
been gone on for almost a year now as well. You not that you're wasting your time. It's a lesson learned because I don't see
Yeah.
time as wasted. It's a lesson learned. This is 85% it. Sis, go find that 100%. That's for you, please.
No, honestly, and that avoidant angle of running away when it's time to talk.
It's giving
How-
red
no,
flag.
sorry, how will you do that in a relationship?
Thank you.
Like, what's your plan for the actual relationship
Relationship.
conversation?
if
So
this is just the
he's gonna
precursor
run away when it
situation.
gets hard. Be so serious.
Yeah.
Well, you run away now. You run away first, baby.
Right
I
now,
think that'll
and
be
it will
good.
hurt you, but you heal.
Also, you're just showing that you love yourself more. Like just knowing what you respect
Yeah.
and what you're happy to take and not happy to
Exactly.
take. Some people might be happy just to
Ride
wait
the boat.
around
It's a
and
long
ride the
go
wave
home.
and hope that one day he'll change his mind. But
Yeah.
how long is a piece of string?
No,
Yeah.
honestly.
2 days, 10 years.
And if you're
A
looking
lifetime.
if you're looking for commitment and that's what you want, sis, this is not it. This is
And it
giving in
probably
5
will
years'
never
time.
be it.
He'll still be saying I'm not ready, and no one's got time for that. So
I saw some tweet, and I've actually been living by it with guys.
Mm.
Like, let this guy treat you like you're his dream girl. Like, because if you think about, like, even from movies, what a dream girl is and how, men can love.
Men can love.
Men
They
can
be
love.
men can love.
So, yeah, like, all this not ready for relationship. If you're his dream girl, he'll down the line, though.
Exactly.
Yeah.
No, it's true.
Like, so, yeah, you're not his dream girl. And that's okay.
I'm
No,
sure she
literally.
knew that you guys were going to say that. You know, sometimes you know the answer.
But you know what it is?
But you just need somebody to say it out to your face. You know, you know your answer.
That humans ask for, though.
Yeah.
Like, even with your friends.
You
You're
just
like,
want to hear it from
please,
somebody
can
else.
you say it too so I know I'm okay?
Aligned with what you're saying, yeah.
So I just need that to just be like, do you want to smack now? No, I don't.
She does. Okay, so that's what you need to do, right?
Right.
Sorry.
It was
No,
really
literally, sorry. But you'll be right.
No, you will. You'll be right. Watch Heartbreak 101. You'll be
Yeah,
right.
no, honestly, you got some tips.
You got some tips, yeah. You'll be right. Trust me. We've been
Not
there.
watch the episode. Is it?
I'm promoting for us.
Yeah. Well,
That's it, guys.
that's it for us today.
All right.
Thank you so much.
Thanks
you
for
so much,
having
Dr.
me.
Adanna.
I hope everyone found it helpful.
Yes, and even
Hope
more
you guys
so.
learnt some stuff.
I
Yes,
definitely did.
I
Yes, thank you
did.
so much.
Good.
Yes,
Good.
guys, we'll be back again in 2 weeks' time with another
Yes.
episode. Stand by.
We will
Watch
see you
out.
soon.
All right, guys.
Take care.
Bye.
Bye everyone.